Hi, it's Xanthe here. I haven't really felt like speaking on video lately. I've been focused on painting, plus just felt really blur today. Dark circles in my eyes. I don't know if some of it's partially a withdrawal from a medication and reducing. Anyway, somebody asked whether I would talk about the difference between bipolar 1 and 2, especially as they are diagnosed apparently with bipolar type 2 and ADHD, and they said that the psychiatrist said that it makes it tricky with medications. I've got notes written here because my mind is a bit blur, and I've also taken my evening meds, so if I am a little bit more sedated from my usual videos, plus my mood is a bit blur anyway. Okay, so let's try to get this out of my head and hopefully go to sleep well for the night. Okay, so I'm not going to read out all of their comment, but they did read, because it's quite long, but they did mention they'd had a long-term time as a caregiver, there's loss, chronic depression, just having difficulty with quality of life, where they can go to, medications, etc. I am not a clinician. I am not qualified to diagnose people or prescribe medications. I have just spoken from my experiences. So for a long time I was diagnosed with treatment-resistant depression and generalised anxiety disorder. And eventually my diagnosis as primary ones were changed to bipolar type 1 disorder and post-traumatic stress disorder, PTSD. That's the two that I have most impairment from. I have other diagnoses. Anyway, let's just coming back to this comparison. So originally bipolar disorder was called manic depression, which it still gets called sometimes, and that was observing periods of mania and depression, episodic. So it's different to other psychiatric disorders in that it can be episodic. You'll have an episode of a high or a low, and then kind of seem a bit more normal in between. Now, the word bipolar means two poles, and it's a little bit of a, I don't know, the descriptions can vary depending on which country you're in and which diagnostic manual they might use. For New Zealand, we use both the DSM-IV and 5, for example. They have different classifications. So in some countries I saw that they might describe it as a bipolar spectrum, which is more an umbrella term, which is very general. Some people are in favour of that and other people aren't. But let's look at the main two, which is bipolar 1 and 2. There's also a third category, which is, where did I write that? I wrote something about the third category. I'll probably get up to it. I'll try and go through my notes because I'm very tired, right? Okay, so anyway, in the DSM-5, bipolar 1, bipolar 2. Oh, here we go. It was written in the next sentence. DSM-5 TR, which is a text revised version, I think. There's also a category subthreshold bipolar conditions that include cyclothymia and other specified bipolar. Cyclothymia is when it's, some features but not meeting criteria for depressive or hypomania or mania episodes. I'll try and define these words as I go along. So bipolar 1 is defined by having mania for a period of at least 7 days, with or without psychosis. If there is psychosis with the mood elevation, then it should be defined as bipolar 1. If you have hospitalization with the mood elevation, then it should be defined as bipolar 1. So this is my understanding of it from my research reading and my clinicians and myself, okay? Now, bipolar 2, did I say the mania has to be for at least 7 days? And I'll go on and say what mania is. Right. Bipolar 2 is defined by having a major depressive episode lasting at least 2 weeks, plus hypomania for at least 4 days, and I'll try and define those later. I'm just going to try and follow this logically as I've written it down, because otherwise I'm going to get confused and miss bits out. Okay, so there's other labels that are used, but you know, you might have your clinician use with you. So these include, and I don't know if they're actually specified in the DSM-5, I think there might be DSM-4 terms. Rapid cycling, so that's defined as 4 or more episodes in 1 year. There's another term that gets used quite a bit, mixed features. So that's like features of both depressive and elevated mood at the same time. Because it's a little bit of a weird model when they try and say you're either elevated or depressed. You can actually have the combination. So that also can be called dysphoric mood. Because elevated mood often will get called euphoric. Okay, mania. Mania can be with or without psychosis. Psychosis is hallucinations and delusions. You can also have psychosis with major depression. Some people will get psychosis. And also a schizoaffective disorder, which can, I believe, if I recall this correctly, be classified as bipolar type or depressive type, I think. The difference with schizoaffective disorder is it has the psychosis is a very prominent feature, like, and between episodes. It's sort of like, I think it kind of comes under the schizophrenia category. You know, some of these diagnoses kind of overlap. Okay, so mania, you're very, very likely to have been hospitalised for it. I have been myself. My mania was described as not having psychosis, but on the edge of psychosis by my clinicians. So, you know, some features. Okay, and that's partly due to the severe sleep deprivation that goes with it. Hypomania, by definition, means below mania. It does not impair functioning clinically as mania does. Mania can impair functioning severely. Does not need hospitalization. No psychosis. So let's have a look at the elevated mood, whether they are in mania or hypomania generally. Mania is way more intense and is noticed by everyone. Hypomania, you could still theoretically go to work and stuff, but, you know, in kind of in a way, seem to do well. Like, it's sort of like to the point of no return when you go to, seems like it when you go, can kind of increase your productivity in a way that is seen as good. I just want to say, while I recall, with my diagnosis of bipolar 1, by definition, it says if you've had at least one incidence of mania. I've actually held the whole mood spectrum, major depression, hypomania, mania, mixed features, whole freaking lot. Okay, so it is often the case. So there is a difference, but quite often my clinician will just refer to elevated mood because it may not be a mood episode reaching the, 4 days or 7 days or whatever we're trying to control it. Okay, manage it, whatever. So elevated mood, looking at my list here, some of the indicators of elevated mood: pressure of speech, that means you're talking really, really fast, much faster than normal. Increase in goal-directed activities. You could say that with my past week of just trying to do 2 paintings at the same time, which I did. And now I'm kind of burnt out. Racing thoughts, or flight of ideas. Brain is just going really fast and jumping from one thing to another. Psychomotor agitation is just needing to move all the time. Maybe pacing around. Increase in self-esteem can be called grandiosity. You sort of like you know, kind of a bit, I don't know, overconfident in your abilities. For example, euphoric, that's different from just feeling joy. It is a natural high that a lot of people take drugs to try and get, ironically. You don't have to take medications to try and stop me, you know. A little bit of euphoria is okay, but it depends on how much else is going on, you know, and whether you're in control of it. Decrease the need for sleep, and actually kind of not really missing it for a while until the wheels fall off. Risk-taking, poor judgment, impulsivity, some of that can go with ADHD as well. It can be, it might vary from person to person, but it might be hypersexuality. Some people, it might be spending sprees, it might be, you know, driving too fast. You know, there could be different ways, you know, starting a business and making bad investment decisions or something. Okay, so basically the mania is like energy, mood is like energy. These are classified as mood disorders. Bipolar disorder and major depressive disorder are classified as mood disorders. Mood is emotions. It can involve emotions, but they're not the same thing. Mood is bigger. It is your appetite, it is your libido, it is your sleep, it is your productivity, it is your, you know, anything, your energy. Elevated mood is like shitloads of energy, basically. I was taking my slippers off. And depressed mood is like no energy. So yeah, I guess I've been feeling a bit depressed today, but it's probably kind of a combination of my withdrawal plus just a bit burnt out, I guess. Anyway, depressed mood, loss of energy, feeling fatigue, definitely feeling that today. Lack of loss of concentration, anhedonia, I think that's how you say it. So lack of joy or pleasure, things that you normally enjoy. Low self-esteem, might be weight loss or gain. Suicidal thoughts can go on there, the ideation, whether passive or active. There can be feelings of worthlessness and inappropriate guilt. May feel sad, irritable, hopeless. Yeah, I think I'm kind of more burnt out feeling because I've just been feeling some of this loss of energy, lack of concentration. That's why I've got my list in front of me, reading it basically. Just not energy to do anything really. I mean, I did manage to clean the shower today, so there was something, I suppose. Okay, so but it's not by definition a major depressive episode because I don't have all of the necessary features plus, you know, for at least 7 days or so. It's not just your normal ups and downs that people might get. It is way more than that to be a mood episode. Okay, so oh gosh, we actually got through this pretty good. Let's just have a look. We've hopefully got time and I'll look at this video tomorrow and hopefully I'll have a bit more energy. See if I manage to speak clearly enough. Okay, so how do the clinicians treat this? Okay, so the first line of treatment is antidepressants for major depression. Major depression and the bipolar depression are actually the identical symptoms by classification, but they're considered to be two different disorders. So they're actually treated, if there's no signs of mood elevation anywhere, treated with antidepressants. And that's what I presented with depression every time I was ended up at the doctor's. I was told I had treatment-resistant depression and severe depression and antidepressants, and they told me I had to stay on them for life. Now I'm told that I stay off the antidepressants. Now, I think part of the reason why they, well, this is like reading, when I saw someone, because these, brain's a bit scrambled, brain's shutting down a bit. a psychiatrist that was involved with these classifications of these DSM and all that. He said that the bipolar type 2 was brought in later, and it was brought in to distinguish people from major depressive disorder, because the main reason to be careful with antidepressants, because antidepressants might trigger elevated mood, in particular mania, which is a very serious condition. Problem is, a lot of people who have treatment-resistant depression may actually have bipolar disorder, but because they feel productive and energized and feel like they're going to do things and, can focus on things for a while, it's a bit of a change from the depression. So it's not really picked up, but it can make things overall more of a roller coaster if you are on antidepressants. So apparently it was introduced to distinguish people with major depressive disorder, but it was put under bipolar disorder. There's all these different ways that you could classify all these things. But anyway, whereas the bipolar type 1 would be closer to what would be the classic manic depressive, and the clinicians actually have used that terminology with me as well. Now, but once you get into, if you have mood elevations, so the clinicians will be more likely to try mood stabilizer. One of the classic medications is lithium. I personally hated lithium, and I refuse to go on it ever again. But there are other medications on a anticonvulsant as a mood stabilizer. It's for people with epilepsy, seizures, etc. But they found that it helped people with mood. So, I found that is a better one for me to tolerate the side effects. Now with ADHD, if people, ADHD can look kind of similar to some of those lists that I read out. But one of the key features, so I understand, it's just not really mood. I mean, sure, and this is where people will confuse mood and emotion again. There might be impulsivity and, a little outbursts or whatever. But, poor judgment or whatever. Now, difficulty concentrating, stuff like that. Can go with difficulty concentrating, can go with either very elevated or very high or very low mood, incidentally, but it's not really categorized by the real big mood episodic nature of it. When there'd be a time of weeks or months when you'd be very up or very down necessarily, and stimulants can actually trigger, for some people, if they have an underlying bipolar disorder or a diagnosis of bipolar disorder, it may cause mania episode or rapid cycling, and same with antidepressants. So, the classification, I believe, in my personal belief, is why they distinguish them, is to sort of signal this person needs to be used with more caution with these sorts of medications. This is what my personal view of it is. What else have I got written here? I've already mentioned schizoaffective disorder. So the person that asked a question, sort of wanting sort of quality of life and what can they do, and is there some special medication or something? They mentioned some things that could be quite complex. There's possible grief, burnout if they've been a caretaker for an extended time. They mentioned loss, this is grief, like grief and loss. Those sorts of things might be helped by counselling or therapy. I have been seeing a clinical psychologist for years. Fortunately, it's paid for. It's funded in New Zealand because it comes under my trauma stuff. Oh yeah, and trauma stuff can look similar. And a doctor who assessed me last year actually did mention that, this has been denied for years and saying, bipolar disorder has nothing to do with trauma. Saying, well, actually some research does link it. And I've actually seen research myself that does link it. In some cases, trauma can bring out bipolar symptoms. And for me, the trauma stuff is very, very much tangled together. So treating the trauma stuff makes the bipolar disorder stuff more manageable. So how the mood stabilizer works for me is, there's no cure for it, right? But what it does is it just helps manage it a bit more, stay in control of it more, so it can be more safer about things and make better decisions and things. But, some people with bipolar disorder will give away all their money, for example, But anyway, it's to help stop the highs going as high and the lows going as low. But what I find, this is personally how I see it, so it's like a body of water. When you've got waves, you have big waves, or you might have little waves, but you might have lots of little waves, sort of more rapid cycling. There's also, people like to argue is bipolar 1 or bipolar 2 worse. I think that they both can suck, and effectively with what I have experienced, I've experienced kind of like both together. If you move from, people can change from a bipolar 2 diagnosis to a bipolar 1 disorder diagnosis. There's no perfect classification of all of this stuff. I still have ups and downs, but they may not be clinically defined episodes now. But you can become more aware of things. Despite the medications and therapy, you could argue this past week I've been hypomanic, and I'm just kind of, burnt out from that. What I do notice though is that the bigger the high, the bigger the crash can be. The crash is very, very, very stressful. It's when I've also had a severe suicidal ideation. So anyway, some people with bipolar disorder might have one episode and they'll have another one for years. Other people will be struggling with this despite medicine therapy. I still have most of my impairment is actually considered now, rated last year, to be from PTSD despite treatment. So 2/3 of my impairment is from PTSD and 1/3 is from the bipolar disorder, because I will still get some symptoms despite medication. But I'm definitely more self-aware and in control of things than what I was. Completely, lost the plot for a while. It can be very complicated, very complex. Things can look similar. It's important to get a correct diagnosis. And medication side effects can also suck. And that's actually one of the reasons why I'm trying to reduce one of my medications, with talking to the doctor about it. And, just slowly reducing, just seeing how we go. And, it's all pretty rough, but it's a bit like diabetic managing, your type 1 diabetes versus type 2 diabetes. It's type 1 you'll probably need insulin, whereas with bipolar disorder, type 1 you'll probably need medications to manage it. Type 2, it depends. Depends on how frequent and how severe the episodes are. It's going to vary from person to person. Sorry, my speech, I think. Anyway, I'm really, really tired. I need to try and go to bed and try and get some sleep. And some of my sleep issue at the moment isn't really caused by myself. It's actually some annoying other factors, like some about 6 dogs next door that decide to bark early in the morning, for example, you know, that kind of thing. But anyway, hopefully I'll be feeling a little bit better tomorrow, but I definitely don't feel guilty anymore about needing rest, and I need it. Thanks.